The Eastern Cape has entered the stem cell age with the opening of the province's first specialist haematology treatment unit. This unit, situated on the 7th floor of the Provincial Hospital in Port Elizabeth, is the result of many years of lobbying and facilitation by the Igazi Foundation. The foundation was founded because the Eastern Cape suffers from one of the highest incidences of blood cancer in the country. According to Dr. Neil Littleton, Head of Department of Clinical Haematology at the Provincial Hospital, there is hope that the high incidences of blood cancers will decline once the ward becomes operational.
You can treat them locally. Just the other day, just with a bit of fanfare that the press have done, we got a patient sent in from Umtata, who's now in our ward. So, yes, we have a high incidence, an alarmingly high incidence, and the ward can start treating the patients, or at least we will treat the patients in the ward.
Furthermore, patients can be treated locally and no longer have to travel long distances to Cape Town, Durban, or Pretoria, where they previously had to seek treatment. Accommodation and support for patients outside of Port Elizabeth will be provided by the Igazi Foundation as a complementary service in the future, explains Cole Cameron from the Igazi Foundation.
All right, Tanya, we're looking at various options. We've identified a couple of buildings. We're also looking at the possibility of actually working together with CHOC, who have 8 houses all over the country. And this would be particularly useful because we in the next year are slated to, I shouldn't say slated, we are earmarked rather, to grow into the Western Cape and to Gauteng. So possibly having such an association would be more beneficial than setting up our own homes. But we're busy looking at all possibilities at the moment.
The Igazi Foundation hopes to serve as a model for the opening of haematology wards around the country, and also as a way in which the private and public sectors can work together to provide medical care. But already the unit has received strong interest from hospitals, both national and international.
We've had a lot of interest from Gauteng, particularly the Albert stem cell transplant unit. They are the largest stem cell unit in the world. They've been very interested, and they are associates of Dr. Littleton for many years anyway. They came down, they're looking at the possibility of perhaps a private-public partnership here, which would help our unit to grow. At the moment, our unit would be strictly for state patients, and we would like to grow into being able to treat private patients as well. Also, Salgrenska University Hospital, just as an aside, that's the hospital that they filmed The Girl with the Dragon Tattoo in. They were here and they said this is actually better than any facility in Sweden, and they are very keen to set up an exchange program, possibly for skills transfer, and also possibly to have registrars here to complement our own staff, as we are very short of the doctors, haematologists in this country. There's only 15 in the whole country.
With the opening of the province's first comprehensive haematology unit, the number of transplants are expected to increase.
Well, you get 2 types of transplants. You get an autologous or an allogeneic stem cell transplant. Autologous meaning your own, allogeneic meaning someone else's. So what one does is you harvest, if you're going auto, you harvest the stem cells from the patient, and you can either give them immediately back if for a disease like myeloma, or you cryopreserve them, in other words, you freeze them. And then you bring your patient back in later, and then you myeloablate, you destroy their bone marrow, in an attempt to destroy any residual cancer, which you weren't able to kill off with your chemotherapy. So when you give chemotherapy, you have to give small doses. Otherwise, you wipe out the patient's bone marrow, and then the patient will die, because you can't live without a bone marrow. But now, you've given your chemo and you've reduced your tumor burden from, say, now here to here, but you're still stuck with this residual tumor. And if you stop your chemo, it will just grow again. But you can't continue chemo indefinitely. So you got to do something now to get rid of and to try and give the patient event-free survival. So if you harvest the patient's bone marrow in the form of stem cells and you have them safe, frozen in a cryopreserver, you can bring your patient in, and instead of giving so much chemo, you can give so much chemo in an attempt to try and wipe out any residual tumor. Then to save the patient, you just take your stem cells, defrost them, and give them back to the patient. It's like a garden. I explain to my patients, you have, at the end of winter, you have your garden, your veggie garden that you want to start up again, and you get there and there's last year's tomato bushes, which is your bone marrow, and a whole lot of weeds, which is the cancer. So what you do is you take a fork and you hoe everything out. That is the equivalent of your chemo, which just wipes everything out. Then you got nothing. Then you go make a little furrow and you throw in your seeds and you close it up. That's a stem cell transplant. So the following day you still don't have a garden. You have to speak to it, water it, keep the chojos and the birds and everything. That's the infections and everything that you have to guard your patient. A month later, you've got something. So that's how I explain to my patients that it takes a month for the stem cells to grow back so that they have a bone marrow. Okay. And that's a trauma. And during that time, you have to look after them. And that's where the protected environment comes in, that we have now just built in Port Elizabeth.
Okay, and the process, is it painful or not really? Or
it hurts sometimes your shoulder when you...
Okay.
No, seriously. The actual transplant is like a blood transfusion. So
Okay.
People think there's a big operation. And a lot of donors, potential donors, think it's like donating a kidney. You only have two, and if you donate one, you've got one kidney left, and it's a big operation with a scar. The truth couldn't be further from reality. The point is there is no operation, there is no scar, and it's like donating blood or hair. Your body replaces it. The only difference is you as a human being are richer for the knowledge of having helped a fellow human being. So that's also the problem with the patients, is because they don't see a big scar of a stenotomy or a laparotomy, they forget they've had a transplant and they think they can do what they did before, and they're only like 4 months post-transplant, and they push themselves because they feel good. And that's where a lot of the problems come in, and you have to smack your patients and say, can't do that.
Okay, so can anybody become a donor, or how can the general public get involved? How can we help?
Number one is you can become blood donors. We use a lot of blood products. I mean, to bring one patient just through induction chemotherapy, you use so many platelets and so many blood products. So blood donation is paramount. Then to put yourself on as a potential donor, the Sunflower Foundation is doing that in South Africa for now. And one can contact them. You go onto their website and then you just follow the instructions.
Okay.
When receiving a transplant, patients need to be kept in strict isolation during the process in order to protect them from infection. Careful planning went into all aspects of the 6 isolation wards, like crystals placed in the middle of 2 sea-facing windows to absorb moisture.
Now the pink crystals here, they absorb all the moisture between the 2 panes of glass, as can be expected in a coastal city. Okay.
Attention was also paid to something as simple as no grouting in tiles behind basins or no curtains in the wards, as these are all places where germs can flourish. And because patients sometimes have to stay in isolation for long periods of time, they can keep busy by watching DSTV, and they have access to the internet to help them keep in touch with the outside world. Other facilities in the 20 million rand unit include a general male ward, a general female ward, a day ward, a chemotherapy room, and doctor's offices.
I would like the population to go onto our website and to like us on Facebook and on Twitter. Essentially, it's not about us, it's about the patients and the people of the Eastern Cape.